Good afternoon, I'm Jess De Los Santos. This is One News Now. The Health Department has expressed concerns over the uptick in COVID-19 cases in the past days. The DOH says the rise in cases is still manageable, but the public should take extra caution. Mobile journalist Jacob Lazaro with the story.
Nobody wants to be a Grinch that stole Christmas, but health officials are noting with increasing concern the uptick in COVID-19 cases during the holiday season. In Metro Manila alone, the positivity rate or the percentage of those who tested positive for COVID-19 has already doubled in just 1 week, from 0.7 to 1.5%. 1 week growth rate in the National Capital Region has also increased by 49%.
It's not significant enough yet, but it is an alarm. It is a warning for all of us that cases might start to increase.
Given the lag time of reporting and the 1 week incubation period of the virus, the uptick don't even reflect the increased activities of the actual week of the Christmas. In fact, infectious diseases expert Dr. Ronjean Solante says, we may expect to see a new surge by the end of January.
It may not be as bad as that, but we have experienced last March or August, because a lot already has been vaccinated.
Local experts agree that it's just a matter of time before an Omicron-driven surge happens, especially since the DOH reported the country's 4th Omicron case. A 38-year-old female who is a returning overseas Filipino from the United States was quarantined upon arrival on December 10 and turned positive on December 15.
Sa ngayon, ang atin pa rin pong natatala na Omicron case ay 4, galing pa rin po sa labas.
On December 24, she was discharged as an asymptomatic and has since been under home quarantine.
Yung detection natin sa sequencing for this 4th case natin ng Omicron came after when the individual was discharged already.
But Solante said, since the Omicron variant is 3 to 5 times more transmissible than the Delta variant, it is best to take extra measures in dealing with these cases.
Dapat sana doon sila sa institutionalized quarantine facility rather than just be at home. Kasi hindi mo naman ma-monitor kung sinong pumapasok o sino nang nahawaan ito.
Mobile journalist Jacob Lazaro, we are One News.
The DOH confirms that the husband of the 4th Omicron patient in the country has also tested positive for COVID-19. Health Undersecretary Maria Rosario Vergeres said his DNA samples will be processed for genome sequencing. The couple were tested on the same day and were isolated upon the release of their positive result. After the 10th day of isolation, they were discharged, both being asymptomatic. The DOH says they will be retested based on existing protocols. President Duterte says a law hindered him from immediately declaring a state of calamity after Typhoon Odette's onslaught. In his talk to the people, Duterte explained that he needed to wait for an assessment from the NDRRMC before making the declaration. The president has placed 6 regions under a state of calamity several days after Odette ravaged Visayas and Mindanao. The declaration of a state of calamity allows the government to use emergency funds to assist disaster-affected residents.
We cannot declare the state of calamity kaagad. For the simple reason is there's a hindrance, a legal obstacle. There is a law covering the power to declare a state of calamity. These are the things that are the stupid laws passed by Congress.
The Environment Department has formally lifted the ban on open-pit mining in the country. DENR Secretary Roy Cimatu noted in the order signed last December 23 that the lifting of the ban is meant to help the economy recover. Cimatu said that it will help provide raw materials for construction and spur employment in rural areas. The agency has formed an oversight committee to monitor mining operations. This is to make sure that public health and environment safety will still be prioritized. Open-pit mining was banned by former Secretary Gina Lopez in 2017.
Yung lifting na ay in accordance with law, at saka ito ay properly secured yan ang environment natin. May quid dito dahil meron ng local na magmomonitor, kumuha pa si Secretary ng National na magmomonitor aside from the MICC.
Some private hospitals will kick off 2022 with a so-called PhilHealth holiday as a way of protesting the state insurers' unpaid claims. Camille Samonte with the report.
A group of private hospitals is eyeing to hold a so-called PhilHealth holiday from January 1 to 5. This means some hospitals will not accept PhilHealth benefits during this time period for any of their offered healthcare services. Patients who are PhilHealth members will have to pay hospitals in full, then ask for reimbursement from PhilHealth afterwards. The Private Hospital Association of the Philippines says this is their way of protesting against the state insurers' unpaid claims. This is also the group's way in supporting their member hospitals who want to cancel their partnership with PhilHealth.
Gusto lang namin iparating na parang yung aming kasing mga hinihiling sa PhilHealth na mga kabayaran sa aming mga claims for reimbursement ay hindi naman natutugunan ng PhilHealth.
The group notes that PhilHealth's unpaid claims have reached up to 9 to 10 billion pesos. Because of these, hospitals warn that some facilities may have to shut down due to lack of funds for their operations. PHAPI says it will release this week the list of private hospitals that will participate in the PhilHealth holiday. The group's president, Dr. Jose de Grano, meanwhile clarifies that hospitals will still accept patients even if PhilHealth holiday is in place. If patients will not be able to pay hospital fees in private facilities, they will be referred to public hospitals. De Grano appeals for the public's understanding of their decision.
Hindi namin talaga ito gusto. No? Survival na po itong iniisip natin. Sa pamamagitan po nito, ay kaya naming masustentuhan yung aming mga resources.
Meanwhile, PhilHealth says it has now fast-tracked the release of over 11 billion peso payment claims through a debit-credit payment method. But PHAPI argues PhilHealth's mode of payment is unacceptable. They explain this method only allows an upfront payment of 60% of the amount, while the remaining 40% will only be paid once documents have been processed.
Magbabayad po sila, bakit po may kondisyon pa sa babayaran kung magkano ibabayad sa inyo at saka may kondisyon kung paano nila babayaran kayo, which is sa tingin namin ay hindi katanggap-tanggap.
For News 5, Camille Samonte, we are One News.
Here's a quick look at today's other top stories. Death toll from Typhoon Odette has reached 397, according to the latest count by the NDRRMC. More than 1,000 people were injured while 80 are still missing. At least 500,000 people lost their homes to Typhoon Odette. Estimated damage to infrastructure and agriculture is pegged at around 21 billion pesos. Malacanang is backing the health department's move to do away with daily case bulletins in an effort to streamline data. Acting spokesman Carlo Nograles said that with more people getting vaccinated, cases will more or less be mild. The DOH clarifies that the daily case numbers will still be available in their website. And the Manila Bay Dolomite Beach has been reopened to the public after almost 2 months of closure. Visitors need to make an appointment at least a day before to secure a time slot. Walk-ins will only be allowed if there are slots available. Only 300 people at a time are allowed to visit to avoid crowding. For more updates, visit News 5, the Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on the Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. Mask on, wash hands, and stay safe. Philippines, I'm Jess De Los Santos. We are One News.